Dear parents and friends, e learning is the new norm. We are all moving from the textbooks to the new digital world. I am Dr. Sathyan Parthasarathi, Director, Satyan Naikar Hospital and Coimbatore Glaucoma Foundation. This is the disclaimer. Presentations are intended for educational purpose only and does not replace independent professional judgment. This presentation contains general information relating to headache and digital eye strain. The information that are provided are evidence-based and also out of our personal experience. By providing the information herein, we are not diagnosing or treating your condition and is not meant as a substitute for any treatment. Continuous presence of headache with other symptoms need proper evaluation and treatment. The data and few images in these slides are taken from Google search and are used only for educational purpose and not done under intention of any promotion. What are you really worried about in the children's eyes? Or what can go wrong in the eyes of your children? Let us concentrate on the anatomy of the eye. You can see the red arrow coming from down, focusing on the muscle which is called as the ciliary muscle. I have given two pictures similar in nature on the left and the right hand side. If you can concentrate on the ciliary muscle, I have mentioned it here as relaxed ciliary muscle, which is important for us to see the distance. And if the ciliary muscle is contracted, then you can see the near things very clearly. So what happens to these muscles? When keeping the digital devices very close to the eyes, and if you have a very small fonts in your digital device, and if you have a very small screen size and dim lighting conditions, and of course the longer duration of usage, the ciliary muscle goes for too much of a contraction. So this causes headache. Also causes increase in the power of your children. That is called as myopia. Most of you are aware of. If your child has a myopia, there is a possibility that myopia can increase. Or if your child is not having myopia, there is a small possibility the child may develop myopia if you are going to use the devices for very long duration. What can be done to make it better? All of us have moved from small devices to bigger devices. With the improvement in the technology and also the size of the device also has increased in its size. So we can move from small device to the bigger devices. So the font sizes can be much bigger for the children to see. If you have the other options, if you can move from mobile phone to iPad or any iPad-like devices, from Android devices also you can use, or you can use the computers, either a desktop computer or a laptop computer where the screen size is much bigger. So making the screen bigger and increasing the font size and also keeping the adequate brightness will help the children much better. Also, there is another option for you to understand is something called as screen mirroring. It is available in all the smartphones. You can go for the screen mirroring mode either in the Android device or iPhone devices. You have the screen mirroring. So you have to just click the screen mirroring, and you can see in the big screen, you can share it with your big screen televisions. So you can sit at a distance, you can hear much better without any disturbance of your small mobile phone devices or the iPads. So this is much better. You can see from a longer distance, and also you can hear better. If your television is not having a smart screen devices, you can use the screen mirroring devices which is available freely in the online. You can buy one which is suitable for your televisions, and you can screen mirror it. The next important is the sitting posture. If you can sit correctly, what is described here, which makes your child much better. The eye strain, the back pain, and the physical uncomfort, everything is being taken care, especially when you listen to the classes for longer duration of time. What next? Can you all see this 20, 20, and 20? What does it mean? When you sit for 20 minutes, or when you are using the digital devices for 20 minutes, get up from your chair. At least for 20 seconds, you have to see a long distance, at least 20 feet or away from 20 feet, so that your ciliary muscle will relax. If you are not going to do that, when the ciliary muscle goes for contraction or too much of a contraction, that is what is going to cause the headache or the digital eye strain. So what is the next problem? The dry eye syndrome or the dry eye symptoms. In many of us, we all have it. So what are the symptoms that one may experience? Sandy or gritty feeling in the eyes, excessive tearing, burning in the eyes, watering in the eyes as I mentioned earlier, fluctuations in the vision, itching, tiredness, and so on. And once the symptoms keeps increasing, you will again get more headache. So what can be done to avoid this problem, or how do we really treat? The main thing which we concentrate is on explaining the children or the parents about how to use the digital devices is the foremost important thing. Second is giving the medications, like we usually give the lubricating eye drops. If the child has more inflammation, we treat the inflammation, and if the glands are not secreting properly, we treat the disease as it is. Understanding about the dry eyes is essential. Perhaps it is most important. By just doing the small changes, that is called as the lifestyle modifications, can definitely the dry eyes can be much better in a much better way. It can be managed. Do we really have any other problems? Yes, we do have more problems. The blue light. Blue light is important, but how it can damage, let us see. How it can alter the hormone called melatonin in our body. And what is the effect of melatonin in our body? It is a hormone. It is important for maintaining the circadian rhythm, especially for the sleep. And also it is a powerful antioxidant. It boosts the growth and repairs the body, and it lowers the inflammation. So this is the role of melatonin hormone in our body. So how does the blue light affect? The blue light reduces the melatonin secretion in our body. When you get up in the morning, that is mainly because of melatonin suppression or reduced levels of melatonin. That's how we get up. But once you have the blue light from the digital devices, especially the LED devices, the melatonin levels goes down. That is one of the reasons why we may not really have a good sleep in the night. So the avoiding the digital or the LED blue light is again an important uh, again it is important. It plays a critical role in the sleep pattern. So there are some benefits, and also many times, especially when you use it in the night, it has more harmful effects. So when you get up in the morning and when you start using the digital devices, especially when you have a digital eye strain, it is better you use the blue light filtering glasses. When you go to the bed, say a time of around 10 or 10:30, at least 2 hours prior to your sleep, try not to use the digital devices. In case if you have to really use it, then possibly you can use the blue light filtering glasses. I'm going to just give you a small demonstration. This is the blue light filtering glasses, how it is going to be useful for us. Just look at this. This is the blue blocking lens. So when I'm switching it on, you can see there is a blue light. So I'm going to switch it on now. You can see the blue light and it shows the UV there. I'm going to use two different type of lenses to demonstrate you. So this is the normal lens which we have it in our glasses. You can see the UV still appears there. It doesn't disappear because it has no blue light filtering lenses in this. Now you see the UV has completely gone. So this is the blue light filtering lens. When you can use it in the glasses, then it completely filters your blue light. Depending upon each company, the blue light filtering effect can be there. So this is how the blue light entering can be protected. So friends and parents, together we can make our children eye much better. So we are all partners in this. You are a partner. The children's again are important. The teachers who are going to give us a lot of homework, also they are important. Or when they teach for long hours, how do you really cope up with this? And as a doctor, we play a critical role in advising you what to do and what not to do. So we have taken the references from the Google images and web pages for a better understanding. We would like to acknowledge Dr. Aruna, Mrs. Rajashree, Mr. Sri Priya, and Mr. Rashwath for this presentation. Wishing you all a safe learning. Thank you all.